Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan to give our weekly update on the COVID-19 pandemic. But before I begin, we begin today's briefing, which is going to be a brief briefing because of the events that are taking over in our nation's capital. I felt like we needed to address this locally. First of all, I never thought I'd live to see the day when there would be an attempted coup against our government by seditionists, anarchists who want to go in to our nation's capital and do violence and do damage to our free society. We all, at this point, need to denounce, and particularly including those people in the Republican Party who have supported the actions of this president and some of the things that he has fomented that is now taking fruition in our nation's capital. We're hoping that police will be able to restore order, that the anarchists will disperse, and will hopefully return home, and we go on with life as normal. I can tell you that locally we've heard no reports of anything. Our law enforcement are monitoring situations here in Allegheny County and in southwestern Pennsylvania, and thus far we've had no reports yet of anything, and we want to keep it that way. We do these briefings every week to keep people safe. And normally we're talking about COVID, which has done a tremendous amount of damage to our economy, this country, and the health of our loved ones and our community. Dr. Bogan can talk a little bit about some of the numbers. Obviously, we've had a very difficult time in the month of December, and we're worried about what will continue to happen with some of the things that have occurred. The light at the end of the tunnel is obviously the vaccine. And I can tell you we're doing everything we can to get as much vaccine into people's arms and to get people protected as much as they can. One of the prime jobs of government is protecting people's health, protecting public safety, our physical health, medicinal health, all the things that Dr. Bogan and her team and all the way up to the federal level continue to do. But again, we're witnessing something. I'm sure most of you are not even tuning in, and I understand that because the attention of this nation is on our nation's capital right now. We pray for their safety, that our members of Congress and our U.S. senators are kept safe, and all of their staff members and all the people who are in and around the Capitol, that they will continue to do that. So let me turn it over to Dr. Bogan. We're not going to be taking questions today. Amy Downs will be getting back to you with questions, and over the next couple of days you'll be seeing things regarding plans and things that are happening that we'll be doing. Dr. Bogan?
Thank you, County Executive, and good afternoon. Today, I'm not going to spend much time reviewing the county's case data. Earlier today, I gave a COVID-19 update to the Board of Health. A recording of that meeting is available on the Health Department's Facebook page, and you do not need a Facebook account to access it. So I wanted to start by again offering my heartfelt sympathies to everyone who has lost a loved one to COVID-19. This week here in Allegheny County, we exceeded a very sad landmark of over 1,000 deaths during the pandemic. And December was our deadliest month. More than 40% of all the deaths experienced in the county happened in the month of December. I hope we're able to reverse that trend in January and in early 2021. The vaccine will start to provide some protection to our most vulnerable, but that will take time. Meanwhile, we must continue to do everything we can to keep them safe. That means staying at home as much as possible, wearing your masks, keeping physically distanced between people if you go out, washing your hands, and following isolation and quarantine protocols if you are sick or a close contact. Looking at data for the end of 2020, it appears that cases and hospitalizations hit a peak in late November and early December and have been trending down since. While this is encouraging, I am unsure it will continue, as I remain worried about a post-holiday surge. The Health Department has already received reports of cases who attended Christmas and New Year's Eve parties and who have traveled. We're currently investigating 5 New Year's Eve parties, many that included high school students and young adults, with up to 40 attendees each, and multiple cases attributed to each of these events already. As we have seen in the past, cases among young, healthy people can quickly spread to their older and more vulnerable family members and friends. Our case investigators and contact tracers are also documenting evidence of increased travel over the holidays. More cases from other counties and states have been transferred to Allegheny County than usual. This can happen when a person who lives outside of Allegheny County is tested elsewhere. Our contact tracers similarly have also encountered more out-of-state contacts than usual. Even if a close contact lives in another state, our contact tracers call them and provide quarantine information and encourage them to get tested where they are. So now on to vaccines. Across the county and the state, we continue to vaccinate healthcare workers that meet Phase 1A criteria. The health department has been vaccinating at our pulmonary clinic inside the Hartley Rose Building downtown. And due to the need for physical distancing and the small size of that clinic, we can really only vaccinate about 80 people a day at that space. To increase numbers, we can vaccinate. The county has opened a vaccine point of dispensing, or POD, today at the Doubletree Hotel in Monroeville. We started today with a relatively small number of vaccinations to give the staff at the site time to get comfortable with the processes and the procedures. Throughout the rest of the week, we will open up more and more slots. This site is staffed in large part by our volunteers, so I want to thank you all for volunteering and working to help vaccinate our community. Many of these volunteers are retired physicians, nurses, or other healthcare professionals who signed up to be part of our Medical Reserve Corps, or MRC. We really couldn't take this vaccination effort without them, so thank you. We are still recruiting volunteers. We're always happy for more, both people with medical backgrounds and without. So in addition to screening people, administering the vaccine, and watching the waiting areas, volunteers are needed to help with registration, direct people where they go, and other tasks that don't require medical training. There's information how to register for the MRC on our vaccine information page at alleghenycounty.us/coronavirus. As more vaccine becomes available, more pods will open. The health department may run some like we're currently doing at the pulmonary clinic and at the hotel. Community partners like our federally qualified health centers will run others. Colleges, universities, and businesses will set up their own. And the health department could bring in a third party to set up pods around the county as well. As more and more vaccine providers get approved, like local pharmacies, as they're approved by the state, the number of vaccines administered will increase exponentially. All of these options are being worked on and will be announced when they are ready. The health department continues to identify and collect information on healthcare organizations with employees that are eligible for Phase 1A. About 1,500 organizations have already filled out the form we provided last week. We're prioritizing these organizations based on principles shared by the CDC and the State Health Department, intended to maximize benefits and minimize harms, promote justice, mitigate health inequities, and promote transparency. Using the prioritized list, the health department is asking organizations for its list of employees that fit into 1A and inviting those employees to come to one of our sites for vaccination, or referring them to a community partner who's also vaccinating. So I know this seems like a slow process, but we are making progress on vaccination rollout, and in the next couple of weeks, this will be reflected in large increases in those vaccinated. So I thank you for your patience, stay healthy, and be kind.
Thank you, everybody. As noted at the beginning of the briefing, we're having a shortened briefing today because of what's occurring in DC. Our next regularly scheduled briefing is Wednesday, January 13th at 4 p.m. We'll get people's questions answered as soon as convenient. Thanks very much. Have a good evening.